It's been a rough past year and a half for Randy Lum and his 4-year-old son, Miles. So they were excited for Miles's first day at a new preschool last week. But their excitement didn't last long.
We caught a summer cold. And with any cold, for you to go back to school, you need a negative COVID test.
After just one day at school, Miles was home again. He went back on a Friday, but on Saturday, they got more bad news.
I get a call from the YMCA. Long story short, one of the kids over the weekend tested positive, and the kid was at school on Friday. So that's where this was in Miles's class. So Miles was exposed. So his class is automatically shut down for 2 weeks.
Lum and his wife Abigail are back to a reality they thought they'd moved past, trying to work from home while taking care of Miles and his younger sister Amelia. Though Amelia wasn't exposed, they're also keeping her home for 2 weeks.
Abby's upstairs, working normally, and I'm just stuck downstairs with the devils.
At most childcare centers, it still looks like 2020. Kids 12 and under are unvaccinated, so everyone ages 2 and up are wearing masks. And providers are still taking other precautions, which is hard on their business. So says Laura Kohn, an early education and childcare advisor.
Some of them are choosing to serve fewer kids or serve them in stable groups that make it harder to staff. And all of those things are just reducing the total amount of revenue that they can pull in for their business. And already these are businesses operating on thin to non-existent margins.
Sally Chenoweth, the owner of Discovery Preschool in Oceanside, says she's now at 70% capacity. And she's allowing groups of kids to mix in the morning and evening so she can extend her hours. But she can't count on consistency, especially now that the Delta variant is causing cases to surge again.
Like I could have called off my wait list and filled up all of my classes like right away. Could have done it, but I'm just so worried that things are going to go back in the other direction, and then I'm going to have to ask all these people that started. Now you have to leave and go do something else.
Chenoweth says she, like many providers, are struggling to hire new staff. She's also had to pass on costs to parents. This year, she raised rates by 8%. Holly Weber, the owner of Magic Hours Children's Center in Mira Mesa, says she's at 60% capacity now. And she's stuck at that level because she can't hire more qualified staff to increase class sizes.
The only thing that's stopping us is having a qualified staff member to continue to build.
The COVID vaccine for kids 2 and up should be a glimmer of hope on the horizon. It could possibly come by late fall or early winter. But it doesn't make Weber feel much better.
Once it becomes available, how many parents are willing and comfortable? What if we have a significant amount of parents who are uncomfortable to vaccinate their child? How much longer are these restrictions going to continue to affect child development centers?
One positive is that masks have really cut down on the typical illnesses that usually course through daycare centers. Weber says she plans to use them well into the future during cold and flu season, but she's worried about the developmental impacts.
We have 2-year-olds that, that have never seen the faces of their caregivers.
For parents like Lum, he knows the year ahead will likely involve staying at home from work when a kid is sick, even with just a runny nose. And that puts new weight on his day-to-day decisions.
Having kids at home who are not vaccinated, who won't be vaccinated for probably another year, I'm going to wear a mask. I'm going to wear a mask like nothing's changed because nothing has.
Claire Trageser, KPBS News.